In most hospitals, nurses will observe a patient's wound over time in order to determine if there are any new infections or symptoms, or to identify if a treatment is working. Observations made by the caregiver typically include area where the wound is located, shape of the wound, if the wound is swollen or infected, if drainage is present, if the patient states that they have sensation, meaning they feel contact when the wound is touched, an estimate of the percentage of body that is covered by the wound, and measurements of the longest, widest, and deepest sections of the wound. You may have noticed that many of the things that are observed are very subjective. One nurse's estimate of coverage might be vastly different than the next nurse's estimate of coverage. Without a picture, who's to say what's really going on with the wound? Nurses could take pictures of the wound using a digital camera if the hospital has purchased one for nursing use. However, today's process is cumbersome for the caregiver. A nurse must leave the patient's bedside and walk to the central nursing workstation in order to get the digital camera. The nurse must walk back to the patient's room and take the picture. Once the picture is taken, the nurse needs to go back to the workstation, download the picture, save the picture, and then attach it to the patient's electronic medical record. After all of that is done, the nurse must remember to delete the image from the camera's memory stick. If the nurse fails to do this and the camera is stolen, the hospital would be at risk of violating HIPAA privacy legislation in the United States if the patient is recognizable in any of the images. Hospitals all over the world are using area imaging scanners to read patient wristbands and medications. With Xenon color area imaging scanners, the tool belt effect has been minimized, as hospitals will be able to enjoy the aggressive reading of 2D codes provided by the standard Xenon offering and capture color images and link them to a patient's record with just one device, eliminating the many steps that are involved with using a digital camera. Aside from improving workflow, having a color picture attached to an electronic patient record will minimize the ambiguity associated with subjective wound descriptions. In this application, a color picture is truly worth 1,000 words.